Well, I mean, I really do feel like I can think of almost every day when I walk in and say, Hola, me llamo Cristina, Doctora Cristina. I think it definitely, I see the patients relax when they know that their provider speaks Spanish, and they can relate to their provider. I am thinking in particular of a patient that I saw in Honduras with our with some other students who actually did not speak Spanish, students and residents, and actually with another attending physician who did not speak Spanish. And it was a mother who brought her, it's actually a baby who was maybe 12 months old into the clinic in the middle of the night. It was probably 2 in the morning. And the baby was having an asthma attack and was actually not doing very well. Her oxygen saturations were going down and she was really struggling to breathe. And the students and physician were pretty worried about her. And they were trying to give her a nebulizer treatment. And they had a somewhat inexperienced interpreter working with them. And the mom was absolutely refusing to give the baby the nebulizer treatment. And they were trying to kind of talk to this patient, and she just absolutely refused. She would not give it to her. And as they're talking to her, they're seeing the baby's oxygen levels, go down. And so they came up and woke me up and asked me to come down and see the patient. And I walked in and I started, speaking to the mom. And she did. She started feeling more comfortable as she talked to me, and I could tell that she was really worried about her daughter. But there's a belief in the area that cold air is very bad for children and it causes disease. And it's bad for everyone, in fact. Cold air causes disease. And so she took one look at the nebulizer machine that's blowing out cold air, and she said, there's no way that you're going to give that to my baby. And in her belief system, that certainly made a lot of sense, right? And so she and I talked about it for a long time, and actually not a long time. We talked about it, and we talked about how this had medicine in it, and that this was special air that would go down into her baby's lungs, and it would help her baby breathe easier, and that her baby was very sick and we were very worried about the baby, but that this medicine would be really helpful. Then she was fine. As soon as we explained to her, when I explained it to her in her own language, and in words that she could understand, that this was going to be good for her, she was fine with it. And then the baby, as soon as the baby got the treatments, she did just fine. But I think that was certainly a case where I can see that really did make a difference, that I was able to understand the culture, and that the patient was able to understand me in her own language.